CCG is accountable for understanding the health needs of the population and making sure that we plan services that will meet those needs. And then we have to make sure we buy those right services on behalf of our population and then monitor those services to make sure that they actually are achieving the NHS standards that we expect. Engagement is so important because to bring about real change and the best possible services, it involves everybody in the system. It involves understanding what patients and their carers want, understanding how the staff feel they can best deliver that, and then making sure we've got the best international evidence and that we're working from that as well.
I think the CCG is there for multiple reasons. I think it's there certainly for the patients, but it's also there for the workforce, the clinicians that are around.
I expect them to listen to us as professionals and to listen to our opinion about what's best for the patients in our care, because we're the people who are face to face with these people.
So it's important that they have quite a solid plan, understand what the health needs are of that population, and then commission services that provide the care that those patients require.
I think that year prior to reauthorisation was a potentially steep learning curve for us. I think we learnt a lot about ourselves and about the organisation we either were or wanted to be. The past year, I think, has been an even greater learning curve. We've started to do a lot more. I think we've started to be more serious and have greater vision, but with that becomes greater responsibility.
The really excellent clinical leadership in Newark and Sherwood, along with managers working alongside the clinicians to bring about service change, has been recognised nationally, and we have made radical changes to the way that the community services work and also to rehabilitation models in Newark and Sherwood, so we have some cutting edge services for our population.
The CCG is here to ensure that the population of Newark and Sherwood receive the best possible high quality health care. We've been working really hard to try and make sure that local schemes and local initiatives are taken forward so that we provide the best possible care for our patients. This includes preventative health care, public health services, but also the whole wealth of services from cradle through to grave, so making sure that pregnant women and children are looked after well, all the way through to more frail and elderly patients with long-term conditions, and also ensuring that people receive a good quality of care towards the end of life.
I think our role as a CCG is to help support clinicians and, in the best interest of the patients, make sure that what we're delivering is best quality.
We have a really good working relationship with the CCG, and I feel that as healthcare providers we do have a voice in the CCG.
But I know that if I need help or advice from anybody, whether it's a GP or a community matron, specialist nurse, then I know that I can get it.
We meet regularly, we're in regular communication, and it's got a supportive atmosphere to the team in what's quite difficult and challenging work, really.
With working with the CCG, it's enabled me to get to know a lot of the hospital consultants a lot better. It's enabled me to get to know a lot of the community-based teams a lot better. And now, knowing these hospital consultants, I can provide better care for my patients. I'm able to pick up the phone, I'm able to get patients sorted closer to home, quicker, and they have a far better service without travelling for it.
I think the things that inspires me is that the CCG at the moment are talking to lots of different people. They're talking to health professionals like myself, and we're getting involved and we're getting given the opportunity to redesign services.
The CCG are responding to what we feed back and what the patients need, what the deficits are within the services, and actually thinking more innovatively about what we can do in the future to actually take things one step further.
I think the thinking outside of the box and then looking at new ways to try and approach the demands within the health service.
I think they are a really high performing clinical commissioning group. They have really good engagement with their GPs, who are the commissioners. They have done some really good work with their providers, the hospitals, Newark, Sherwood Forest, and also the Healthcare Trust. So they work collectively with multidisciplinary teams, which is really good for the population. So it's not just a medical model, it's a social care model as well.
What inspires me about the way that the CCG is planning healthcare is that I think we've got a real radical vision about taking care out of hospital and providing it where people live in their own communities.
I think we've got a very dynamic CCG here in Newark and Sherwood, and I think that we're very lucky.
We've had a challenging time over the last few years with changing things, particularly in Newark, and we've learnt a lot from previous attempts at engagement. So I think we've learned from it and we're now moving forward, and it's actually a really, really good place to work, and they're very supportive, and I think with the general public involved as well, it can only get better.
I think it's quite exciting actually that your CCG is doing stuff that's quite pioneering and is recognised nationally. And actually when you hear about other CCGs doing a similar sort of thing maybe 2 or 3 years down the line, it makes you think, well actually, you know, we came up with some good ideas to start with, so must be doing something right.
By far the best bit is when you can actually have a genuine conversation with a patient who's been really moved, touched, helped by our services. That's the bit where it kind of feels worth it.
A lot of the people that come in here are obviously elderly, and a lot of them live by themselves. These people here, they somehow seem to be able to get them out of their shell.
I mean, it seemed to be a family unit. You know, you had to come out of hospital and come back home to the family.
I'm very pleased with them, you know, they've done marvellous.
They seem to have more time to listen to you. The kindness and the way that they handled themselves, well, they couldn't do enough for you.
I knew I could leave David and not be worried about that he wasn't being cared for properly, and because he was more confident in moving around and doing things, then it took the burden off me. It eased the situation up for me. So yes, I did benefit and still have benefited an awful lot from it.
It's definitely a step forward. I was ill a few years ago and there was nothing like this. You felt very much on your own. The 2 or 3 nurses I've seen have been, and the actual staff have been very courteous, very helpful, very informative when I wanted to know things. I didn't even know it was there, and I've worked in Newark all my life, but I'm very appreciative that it is there. And they are an excellent group of people, there's no doubt about that.
The NHS is something that we should be proud of. We accept the fact that it may not be perfect, but it's one of the best health services out in the world today. It's still one of the things that people hold true as one of the great things about this country or about the area in which we live. My role in the CCG allows me to be an integral part of that change, that development and that progression. It's certainly a challenge, but actually each day I know that I come in, I'm trying to do my best for my patients, whether they are face to face with me or whether they're just out there within our population that we serve.
What makes me proud to be part of the NHS is that I can make a real difference. I have a fantastic role in terms of seeing patients on a day-to-day basis, being able to treat them, being able to communicate with them, being able to track their lives through and actually see the real difference that we can make. But also I have this absolutely golden opportunity in terms of being the clinical leader of the CCG to really make lasting changes for the future.
I think there's always something that we can improve on. I think we recognise that whilst we have an excellent basis for a service, that there is so much more potential. We hear and discuss about potential inefficiencies within the system, whether it be within pathways, whether it be within general meetings, whether it be within the way we actually provide the care. And I think this is what inspires us to carry on working to try and better ourselves each day. I think we should be proud of what we do, but I think we can be even more proud of what we can do.
The night that we had that terrific flash flood, the staff couldn't go home, the visitors couldn't go home, and we all sat in the dining room laughing, listening to the thunder and the rain and knowing that we were all stuck there.
Last week I went home and I walked from the car to the door and inside and I walked upstairs.
And she came up to me one day and says, "Seen that, David?" Well, I can't see it really out of the packet. I said, "But it looks like a sander." "Yeah, that's right." Of course, out came in the box. And says, "I don't know how it works." I'm doing away, and I'd sanded this bench down. Now suddenly a penny dropped. I says, "You crafty devil." And she just looked at it and she's got a biggest smile and walked away.
Thank you very much. You've done far more than what I could expect you to do, and nobody could be more appreciative of what they've done.